Nobody actually wants a hair transplant. Now I know that sounds confusing coming from me, but let me explain. No one wants to pay lots of money, get poked by needles, recover for weeks with scars, and then wait a year to see a final result. So why then is a hair transplant such a popular procedure? As Machiavelli once said, "The end justifies the means." But what is the end? Is it to look more attractive? Eyebrow hair transplants, for example, create thicker eyebrows that attract more attention to the eyes. To look more youthful? We associate full, thick hair with being more healthy. And many medical conditions actually make our hair fall out to feel more like themselves. Some people don't recognize the person in the mirror when hair loss becomes more significant, and I can attest to that with my own personal experience. Or is it to feel more confident? Perhaps it's to help someone land a new job or to open up career opportunities. Or perhaps it's to stop avoiding certain activities like swimming, for example. Wet hair will often make thinning stand out more and can really make people feel self-conscious. Or maybe it's for finding a significant other. Based on evolutionary theory, a mate might find you more beautiful or more handsome, but also might associate more hair with more overall health and vigor. But for many people, it's actually all of the above, or sometimes many of these reasons combined. For other people, there's a specific goal in mind. Some guys, for example, tell me that they're just tired of wearing hats and they just want to rid themselves of that burden. Some women tell me that they're tired of styling their hair into bangs to cover up a larger forehead. They want to pull their hair back, but they want to feel confident doing that. Getting plastic surgery is always a personal journey, and there's never just one right reason to do it. But I think that there's actually a deeper psychological reason that many people get hair transplants and other types of plastic surgery. And I'll get into that a little bit later in this video, but first let me tell you some of the wrong reasons to get a hair transplant. The first wrong reason to get a hair transplant is because you're doing it for somebody else. Somebody else wants you to get the procedure, but you don't really want it for yourself. But in fact, you should be getting this procedure first and foremost for yourself, not to please or appease somebody else. Another wrong reason to get a hair transplant is to make somebody else jealous. Sometimes it might be like getting back at an ex and somebody breaks up and wants to go get some procedure done so that someone else can see them on Instagram and think, hey, that's impressive what they look like now. Maybe I should get back together with them. That's another wrong reason to do it. Yet another wrong reason to get a hair transplant is to save a failing relationship. Some people have strife with their personal relationships, and they might feel that, hey, if I get something changed about myself, about my appearance, maybe then the person will actually love me or will want to be with me, and that's usually a pretty bad reason to get a hair transplant. Another wrong reason to get a hair transplant is if you're trying to look like somebody else. Some people bring me pictures of a celebrity and they say, this is what I want to look like. Not good. That's a big red flag because you're never going to quite look exactly like that person, and that's pretty much setting yourself up for disappointment. Now, there's a caveat here. Sometimes people will bring me like an inspiration photo and they'll say like, I know I'm never going to look like this person, but I kind of like the orientation of their hairline here, or I like how their eyebrows look, so can we try to match a similar style, but I know that I'm not going to really look like this person. And that's a different situation. That's something that I think is sometimes worthwhile to consider some inspiration photos or celebrities instead of saying, turn me into this person. You might fall into one of these categories for wanting a hair transplant for the wrong reasons. And if your surgeon tells you that they're not comfortable with your case for any reason, make sure to heed that warning. Make sure to listen closely as to why, and do not try to force their hand to operate. That's never a good idea. They might be denying you for at least one of the following reasons. There could be an anatomical issue such as poor donor supply, excessive scarring, or some other anatomical explanation. It might be because you have an underlying medical problem that they feel makes it less safe to proceed with a hair transplant. For example, uncontrolled diabetes with an A1C above 8 is a situation where it's better to take the time to get the diabetes under better control before going for an elective cosmetic procedure. There There could also be a personality mismatch. Listen, sometimes two people just don't get along, and that could be between a patient and a surgeon, just like it could be between any two people. There needs to be some basic understanding and some basic camaraderie, I would even say, between patient and surgeon before you proceed to do an elective cosmetic surgery. This is often an emotionally charged undertaking, and it's something where the surgeon needs to be just as comfortable as the patient in that patient-doctor relationship before they take on that case. And another reason could be that your surgeon decides that your expectations are just not realistic. Now, of course, that's a very subjective assessment, and something that might seem realistic to one surgeon because of their comfort level might not be realistic to another surgeon. And it could just be that your aesthetic does not match that of your surgeon's. And that's why it's often good to get multiple opinions and multiple consultations with different surgeons before you make a decision on who to ultimately go with. But if there is this mismatch of aesthetic preference, don't try to convince your doctor that they should do it the way that you want it, because ultimately that probably won't end well. You have to be on the same page with your surgeon, and that should come more organically and naturally rather than feel forced. But one thing that I think we all need to be aware of is that there are people who are actually addicted to plastic surgery. Just like you can be addicted to gambling or drinking or other things in life, you can also be addicted to plastic surgery, and you can have something called body dysmorphic disorder. Body dysmorphic disorder refers to someone being extremely preoccupied with a perceived flaw that to other people is not so obvious. They don't really see it, yet to the person it feels very real, and it's something that they spend a lot of time fixating on. And it also includes repetitive behaviors such as mirror checking, excessive grooming, skin picking, reassurance seeking, or comparing one's appearance to that of others. Some patients will spend many hours a day on these types of behaviors related to their appearance. And the incidence of body dysmorphic disorder is going to be higher amongst the population that actually goes and gets plastic surgery compared to just the general population. So I think patients should know that this condition exists so that they can get the proper help if needed. And I think that surgeons need to know that this is a very real condition, and they should avoid operating on these types of patients as much as possible to really save them from themselves. This warrants a visit to a mental health professional instead of just jumping into plastic surgery. Now, let me tell you what I think is the #1 reason why people actually get hair transplants. It's kind of like the movie Inception, where there's a dream within a dream. Well, similar to that, there's sometimes a reason within a reason. And the reason is to think less about your hair. And this is kind of counterintuitive because most like luxury goods or services are meant to be used for show, right? Like if you're buying a Porsche or like a Rolex watch or a Birkin bag, you're trying to show it off most of the time so that other people see how amazing you are, that you got this really incredible type of luxury product, and you're trying to show that you have it. And that's different from when you get a hair transplant. A hair transplant result is usually meant to be more hidden, and it tries to bring your own attention and the attention of others away from your hair. So you're essentially investing into something that you're not trying to show off, which is interesting. And it's also different from other cosmetic procedures, such as, for example, a breast augmentation, where you might be trying to bring people's attention to the area that was augmented. With a hair transplant, people are usually trying to bring people's attention away from that area. So the real reason why I think most people get hair transplants is to actually focus on something else in life and to be less preoccupied with their hair. Do you guys agree with this, or do you have maybe a different opinion? What is your main reason for either getting or considering a hair transplant or any other type of cosmetic plastic surgery? Let me know in the comments below.